It's really important to talk about death and dying. Death's one thing that will happen to us all at some point and can unfortunately affect people at any age, from the young to the old. And people feel uncomfortable talking about it, don't like to think about it, don't like to talk about it. Unfortunately, what that can result in is missed opportunities, really, for people to think about what they would want at the end of their lives, what their preferences would be, what their wishes would be. So this year's Dying Matters Awareness Week, the theme is the language that we use around death and dying and the conversations that we have, and in particular the conversations that patients, their family members, their carers might be having with healthcare professionals. So this is important because people need to be able to sort of express what their wishes are, what their preferences are for the future, and healthcare professionals need to be able to explain sort of clearly and honestly with people what their options might be, what treatments would realistically be possible or not be possible, so that the two can come together and have a really honest conversation about what would be best for someone in the future, and they can plan that together, share that plan. So as I said, that means that plan is more likely to become a reality if everyone's thought about it honestly together. And having those conversations, although they might be tricky to have and people might be anxious about having them, actually once people have had those conversations, often it makes them feel a lot less anxious and a lot less worried about the future, and people can feel reassured that other people know what they want and that they'll do their best to help them get that. Be prepared before you go into conversation. Have a think about what's important to you and what questions you might want to ask. Don't be worried about asking the big tricky questions as well. So you might want to ask, will I die from this condition? What might dying look like for me? And you might want to write down some thoughts beforehand. You might want to have conversations with your loved ones or with someone else first. Everyone communicates in different ways, so you can tell someone that you're talking to, a healthcare professional, how you prefer to communicate with them. If you're someone who likes people to be quite direct, then say so. If you prefer things to be a bit more gentle or in small steps, then that's okay too. Sometimes healthcare professionals don't communicate in the clearest way or in a way that you understand it easily. So don't be afraid of asking someone to explain it in a different way, or repeat it another way, or take someone with you for support, or even ask if there's someone else that you can talk to if you're finding it difficult to understand what someone's saying.